Welcome to Anesthetics Unveiled, a concise guide that ties together how anesthetics work, how they move through the body, their clinical uses, and the safety protocols that make modern practice reliable. The central diagram here frames those four themes and sets up the deeper explanations that follow in the presentation. The historical perspective reminds us that ether, chloroform, and even cocaine transformed surgery in the 19th century by enabling controlled insensibility, drastically lowering mortality, and shifting ethical views on pain. Today, those breakthroughs inform drug design, tighter safety standards, and a continual push for faster emergence with fewer side effects. When choosing between general and local anesthesia, we balance scope and risk. General agents induce a reversible coma, affecting the entire CNS, and suit invasive procedures, while local agents block sodium channels to confine numbness to a region. Decisions hinge on procedure invasiveness, patient comorbidities, and desired speed of post-operative recovery. This overview highlights the practical features clinicians prioritize: rapidly titratable hypnosis for precise control, blood gas partition coefficients, governing induction and emergent speed, the rationale for balanced general anesthesia to optimize effects, and strategies to preserve hepatic function and reduce metabolic toxicity during care. In comparing propofol, etomidate, and ketamine, note their hemodynamic and adrenal profiles, analgesic properties, and clinical trade-offs. Propofol gives rapid onset, but dose-related hypotension and minimal analgesia. Etomidate preserves hemodynamics with adrenal suppression risk, and ketamine supports blood pressure and strong analgesia at the cost of psychomimetic effects. Local anesthetic selection revolves around onset, duration, and sensory motor separation. Lidocaine acts fast for short procedures. Bupivacaine works slowly but provides long-lasting blocks with strong motor effects, while ropivacaine offers differential sensory block and better motor preservation, making it useful for extended post-operative analgesia with optimized recovery. The mechanism slide contrasts general and local action. General anesthetics potentiate inhibitory GABA-A and glycine receptors and inhibit NMDA channels, producing neuronal hyperpolarization and loss of consciousness, whereas local anesthetics block voltage-gated sodium channels to prevent action potential propagation and stop nociceptive signaling at the periphery. Functional imaging shows anesthetics disrupt cortical and thalamocortical loops to abolish consciousness, while sparing brainstem autonomic centers that maintain vital functions. This selectivity underpins the clinical safety margin by disrupting higher-order integration, but preserving essential regulation during deep sedation. Inhalational pharmacokinetics depend on partial pressure gradients between alveoli, blood and brain, with tissue solubility and cardiac output determining time to induction, and fat solubility driving late emergence due to redistribution from adipose stores, explaining why some agents wake patients faster than others. Propofol undergoes rapid hepatic conjugation, producing inactive metabolites, and a short, context-sensitive half-life that suits continuous infusion, while local anesthetics are metabolized by hepatic amidases or plasma cholinesterases. Hepatic blood flow and genetic differences influence block duration and the risk of systemic toxicity. Critical complications can be life-threatening, but are manageable with protocolized responses. Malignant hyperthermia calls for immediate dantrolene. Cardiovascular collapse requires vasopressor and circulatory support. And respiratory depression demands prompt airway management, all prevented and mitigated through vigilant monitoring and preoperative risk assessment. This final safety slide emphasizes integrated monitoring and standardization, continuous capnography, pulse oximetry, and depth metrics like EBIS feed analysis, and guidance systems to detect hypoventilation or awareness early, while standardized protocols and ready access to reversal agents ensure consistent safety and rapid response across care settings.